Neurodiversity Zines series. This zine is titled Finding Neurodiversity in Indian Mental Health Spaces. Getting a Learning Disability Diagnosis as an Adult. Some ethnographic insights. I am 24 and I think I'm dyslexic. Can I get an assessment and a formal diagnosis? The mental health professional says, why do you need a diagnosis now? What will you do with it? You've already finished college, haven't you? Yes, but still I'd like to. The mental health professional continues. Sorry, we cannot do an assessment because there are no guidelines yet for adult assessment of SLD in India. Also, learning disability is a neurodevelopmental disorder and has to be established in childhood. If you haven't been assessed in childhood, we cannot do it now. Many mental health professionals associate the need for a learning disability diagnosis with claiming benefits or accommodations only. However, one seeks a formal diagnosis for different reasons. I need a diagnosis to understand myself better. I need it to validate the struggles I've had over the years. Some mental health professionals engage in assessing adults using alternative methods such as relying on tools developed in the West or qualitative clinical interviews. I want a formal learning disability assessment so that I can show my parents and teachers that I wasn't lazy and I really had those challenges. Denying a chance of formal assessment of LD in adulthood is not only unjust and a violation of rights, it is also about discounting the historical contexts of class and caste oppression, lack of access to different resources, lack of awareness, and negating the lived realities of those who identify as dyslexic. My parents haven't studied much. They didn't know about learning disability. If they knew, they would have taken me to the mental health professional when I was a child. Created by Chetan SV. This zine is part of How Do You See Us and How Can You See Us, a creative participatory research dissemination project on disability and neurodivergence in India. This is supported by the researchers from the Global South Grant Fall 2024 from the Society for the Psychological Study of Social Issues, SPSSI, for Chetan SV's doctoral work under the supervision of Dr. Shubha Ranganathan at the Department of Liberal Arts, Indian Institute of Technology, Hyderabad, India.